for today. PHIPA, good enough, or time to modernize? So to get us started, just to make sure we have a good lay of the land, we're on the same page, I'm gonna literally read the textbook definition of PHIPA. All right. The Personal Health Information Protection Act, 2004, is a provincial law that governs the collection, use, and disclosure of personal health information within the health sector. The object is to keep personal health information confidential and secure while allowing for the effective delivery of healthcare. Okay, so what does that tell us? We're allowed to use that data for traditional usage, right? I'm able to collect your individual data for your use. I'm able to disclose your individual data for your use, right? So for example, as your family physician, I can collect your data. I can disclose your data to your specialist and your hospitalist and vice versa for your individual use, right? So in the current state, the use is very individualistic. Now let's say we want to take it a step forward. Can we use that data for direct patient care using modern technologies like artificial intelligence, digital health, population health? Okay, so in the current state, various entities, so hospitals, other entities and agencies like ICES and CIHI can run initiatives for modern technology, but there are limitations. Now I'm going to give you an example. Let's say we want to hone in on the pediatric patient population, so in the hospital setting. So just down the street, sick kids can run these initiatives with modern technology, the studies, the research, but they can only use their data. They cannot tap into CHIO's data, and CHIO cannot tap into their data, right? So what does that tell us? Right? So in terms of limitations, there will be a lot of duplication of efforts. Right? So these entities are not in it or it's not feasible for them to bring it to scale because they're not in it for commercialization. Another tidbit for just full transparency, between the public sector and the private sector, tapping into seasoned software developers and engineers, the private sector is able to dabble into that a lot more than the public sector. Okay, so taking a step back, let's reel it all in. So in the current state, the use of the data is very individualistic. It is siloed. If we wanted to use that data for the greater good, for direct patient care using modern technology, in the current state, we are unable to aggregate that data to train AI for population health or digital health. So I'm going to pause there, and I'm going to turn to my panelists, and I have our first question for the morning. It is literally word for word the title of our topic discussion, which is, do you think PHIPA is good enough, or is it time to modernize? So I'm going to start with Mahmoud. Please take it away.
Thank you. Thanks for having me. Well, definitely, and certainly it is time for modernization of PHIPA. But I wouldn't limit it to AI. I can give you plenty of different examples that even for very traditional statistical analysis, still PHIPA does not allow some of the things that you mentioned. Interestingly, about a year ago, the organization, the institute that I work for, ICES, published a report for recommendation for modernization of the PHIPA. It's publicly available. You can easily find it on the website. There are 5 recommendations in the report that ICES published. I can perhaps use 2 of them as an example here in this discussion. One is for allowing contacting patients for when you can predict if they are going to be at a specific disease risk in the next few years. In the current act, if ICS as a prescribed entity named in the PHIPA under Section 45, we have everything that you can imagine, that all the data from the province of Ontario, in order to predict who, for example, is at a risk of a kidney disease in the next 5 years. It doesn't need AI, actually. Traditional statistic is enough to identify that. But in order to contact those patients and tell them, and actually tell their physician to prevent the future kidney disease, for example, we need to first contact the patient and get their consent, which is practically a very huge burden and almost impossible or very challenging. PHIPA in the current standard, current format allows access to data without consent for evaluation of the health system. And that's what ICS does, CIHI does, Ontario Health does as a prescribed entity. But when it comes to preventing, basically that's precision medicine. When it comes to these type of areas, it's very, very challenging. So that's one area that we can think as an example. Synthetic data is another example that's more related to AI. Now with the AI, you can create synthetic data in a better and more accurate way to represent reality, although it's not real data. PHIPA is pretty much silent about synthetic data. So it's a challenge to generate synthetic data using real data and to use it for the public good. And I'll pause here, and I can continue forever, but I'll pause here.
Awesome. No, thank you, Mahmoud. And you highlighted a lot of key points, right? The consent part, that needs to be covered in PHIPA, which is currently absent. Right now, earlier when I did our preamble, I talked about AI, but you made it known that it's just even simpler uses of that data. We currently can't do that. So thank you for that. So next we have Don. Please take it away.
Thank you. Can I be? Yes. Okay. Well, as you've mentioned, the law is currently framed around traditional uses of information. And even though the law was created in 2004, it's based on laws that on behaviors or practices that go much further back to our Medicare, where we're looking at physician services and hospitals and the transactional natures of those, and largely initially just to serve to work through the financial transactions between the government and paying up for those services. So as Deb Matthews had pointed out earlier, the social determinants of health are a tremendous factor in that we should be working with to predict where we should be putting our resources. We can use those data, but PHIPA does not cover that itself. We have to look to other legislation because PHIPA is working only with data within the possession of the data custodian and for purposes around immediate treatment. So a broader conceptualization model would look at this not only broader determinants, but also the other health information that is not in the custody of the care providers, for example, wearable devices and whatnot these days. So there is a need for a radical change to PHIPA, not just changes at the margin.
Absolutely. Thank you for that, Don. And I think you highlighted on a key piece, social determinants of health, right? We focus so much on the medical, clinical data, and like you said, the traditional use of it. The social determinants of health is so important, and that is a big piece of your health. So I'm just going to add you like a tidbit to that as a follow-up. If we were able to collect that social determinants of health data, how do you think it would radically change our healthcare system?
That's quite a topic unto itself.
Just a very tidbit of just to highlight the importance of social determinants of health data. Right now we don't collect it in the traditional use, but just your tidbit on the thought of if we did collect that, how would that radically change? Because you said it needs to change radically.
Well, it's not to say we can't look at that at this point in time. We've found ways of doing that, but it's very cumbersome, and it's often at an aggregate level, and so. I would suggest, as again, Deb Matthews was pointing out in her work, it would change how we start to prioritize the data themselves and their component. And something I didn't mention a moment ago was we have also used the information for systems improvement, but it's largely been siloed within institutions. And more, we need to be able to compare across institutions and have good interoperability. And the law doesn't handle that well. It is possible to do that. There's a very good initiative, Gemini, that is doing that across institutions. But it is cumbersome to get any of these kinds of initiatives underway, given the current legislation.
Thank you for that, Don. All right, but last but not least, Christine, please shed your thoughts.
Sure, thanks. So Don alluded to the fact that PHIPA was in force in 2004. That is pre-iPhone days. Back in those days, the healthcare system was primarily paper-based. So the speed of data in those days was the speed of the fax machine. So PHIPA as a piece of legislation was well optimized for that regime. Fast forward 20 years later in the digital era, the speed of data, it's basically almost instantaneous at this point in time. And I think a lot of people are frustrated by the current speed, the mismatch between the current speed of data and the administrative regime that goes with it. So I would say on that basis alone, we need to think about the change context and the need to also think about how we need to modernize our legislation to keep pace with that change. It's not that the basic underlying privacy principles and the need for privacy protection have changed. I think all of those things still remain sound and the fundamentals still remain valid to this day. But in terms of how our legislation is structured to meet those needs, I think there's certainly room for modernization. The data already exists out there right now. It's inside all the hospital information systems, the physicians' EMRs, community information systems, and so on. So it's not that the data isn't there. It is. We have an entire health system community that is also wanting to serve the greater good. But I think many people in this room and in the healthcare system are frustrated by the lack of access to data. So we have to ask ourselves, what is actually the problem? And I'll actually put one thing to you about what needs to change in PHIPA. We do have a very fractured healthcare system right now. And the way that PHIPA is structured is that the decisions about data sharing are made at local levels. So basically a hospital as a health information custodian gets to decide whether data is shared or not. A physician gets to decide whether it's shared or not. So everyone in the healthcare system makes their own local decision. And under those circumstances, guess what? Everyone makes those decisions differently. Those that have the privilege of getting to make those decisions about sharing also have to bear 100% of the risk of those data sharing decisions. And that's where things break down. We'll never get to the future state of streamlined data sharing when we still have all these issues around risk and liability that we have to sort out. So I think that's one fundamental equation that we need to solve. So PHIPA is what I refer to as a provider-centric structure when we think about the legislation. And I think that what we need to move towards is a patient-focused or patient-centric or person-centric lens in terms of how we think the data and the protections need to be set up and structured. So I think on that basis alone, we do need to take another look at the legislation. It's time.
Awesome. Thank you. So we do have a consensus that it is time to modernize PHIPA. But before we go into that, I do want to pull on what Christine just shared, right? That PHIPA is very provider-centric. We need to have that paradigm shift to make it patient-centric. I think a lot of the times we forget every single one of us is a patient at some point or time, regardless of what your title is, what profession you are. So we need to remember we are talking about ourselves. Also, some of the tidbits you tapped into is that our system is very fragmented. Also that we need to catch up with the change. So, back in the day, like I think all the panelists have mentioned, right? Traditional use, okay, at that point in time in 2004 was okay, but things have changed and we need to catch up with that. That means the legislation, that means whether it's including more consent, what have you. So based on what you said, Christine, about, catching up with that, making a change, that kind of leads into the segue of my next question of if we have identified, okay, it is time to modernize, there is time to change so we can have access to that data. So not just for AI or digital health, just simplistic uses. Or also, taking into account social determinants of health. Why have we not made this change as of yet? So, to get us started this time, I'm going to start with Don.
Well, I'm going to hearken again to a comment that Deb Matthews made. Inertia. As much as we may have legislation which is creaking at the seams, we've learned to work with it. And to make revisions to it then means we have to change how we do business. And sometimes if we're comfortable enough, even though we may be better off with the change, we resist. And there are many concentrated interests who want to hang on to their ground. The change we're talking about, I hope, would not be change at the margins. And so that would require a lot of rethinking, a lot of discussion, a lot of negotiation. It's very difficult. So I would say that's one major factor here. But also, there's the whole political process where this is not the only legislation that needs to be addressed. How does it get into the queue? How is it prioritized? That's a challenge. And then within the life cycle of the term of a particular administration. In the event of an election call, anything that's on the books has to be set aside. So it keeps getting pushed back. So I would say that the inertia is one of the big issues, and as well the whole process of getting that to happen.
Awesome. Thank you, Don. So you've highlighted there's political aspect of it, right? And change, there takes a lot for that. So next, I'll go to Christine, please.
Sure. So in addition to the political will to make those changes, I think that will also comes from the people as well. And I think that we talked about wanting to use data for the greater good. We have to understand and formalize our understanding of what the greater good is. We can't just talk about it in an abstract way. That's not how you actually change or make legislation. So I think from my perspective, what we need to do is to talk to the people to understand exactly what it is that they also need and want and expect to have happen with their data. Because after all, it is all of your data. And right now, we as people that work in the health system, we're conjecturing. We have our own individual perspectives, but are we all willing to come to some kind of agreement about what that greater good is and who should actually say what that greater good is? So I think that it hasn't happened because we haven't engaged in that active dialogue with all of those that these decisions affect. That includes all the care providers and institutions, that includes the public. So I think we do need to have a dialogue with everyone in the system about what it is that needs to change. And it needs to be an explicit process that we undertake so that we can better understand the requirements to inform change.
Perfect. Thank you, Christine. And I guess we're kind of all building off of that. So Dawn started with, okay, the political will. Other legislations also need to be in there. Christine, you tapped onto the public will and having all the stakeholders at the table. And that just kind of ties into the purpose of today's conference. The FHLIP Conference is to be a public sphere so that we can have these conversations and get the dialogue moving and have that open dialogue. So next, but not least, I have Mahmoud. Please share your thoughts.
Sure, I would like to build on what Christine just said, and also Don. Absolutely, political will should start with public will, but how to create that public will? I guess two things. We do need data literacy in Ontario and Canada. I don't think we have done enough for that. If you look at Europe, a lot of initiatives on data literacy has happened before any other medical change or any healthcare change started. In order to, it can't be one way. The expectation from the public to understand how data can perform in their for their goodwill. We also need to build trust, and that's also important. So trust needs to be built between the government and the people in the public for their data, and then the data literacy, and then everything else that other panelists mentioned can move along.
Perfect. No, thank you for that. So I think another point that was highlighted again, to define what the greater good is. You also mentioned to talk about or have an understanding of data literacy. In the current state, a lot of patients or just the population in general, the masses, don't necessarily have health literacy. So if we're at that level and we're adding an extra layer of data literacy, just a little bit of your thoughts on this, on how to approach that data literacy, given that even right now in the current state with health literacy, we're not there yet. So your thoughts on that, please.
Well, that could be a very big discussion, but there are many ways to inform public and educate public about what can be done with their data for their greater good. I would say from the education system, it would start from the education system to promote and create that infrastructure understanding of what can be done for the greater good using their data, while creating the trust as well that your data is protected and it's going to be used only for your own good purposes.
No, thank you for that. All right, so we've heard from our panelists, so there's so much public will, political will, change in legislation, other legislation, transparency, trust, so much. So we've identified why it hasn't happened. Now let's take it a step further. If we wanted to make it happen, how would we make it happen? What would those next steps be? So this time, Christine, I'm gonna have you go first.
So I alluded to the need to have a conversation with the public. I think that we do need to formalize this idea of the greater good or the public good. What is that? For example, there are actually many things in the current legislation that are already allowed and enabled, like research. But then we start to extend those boundaries into things like AI. Well, is AI research? Is AI good? We have to go through all the use cases for data that we have to understand what our needs and requirements are and be able to answer some of those fundamental questions around what is the public interest to be served, what is the public interest to be protected, what are the benefits for the public. So I think that that's an important next step. I think that the other thing that we need to think about is the conscious formalization of the discipline of data. It's like what happened 30, 40, 50 years ago with IT. Used to be just it was one person, IT was one person in your organization who went around desktop to fix your computer. And we went from that to having a CIO with entire disciplines built around it, departments and so on with very specialized skill sets to do IT. We don't exactly have that in the data world right now. It happens in an ad hoc way, and it's usually picked up on the fly. So we need to actually recognize that data is something that is its own formal discipline. It requires skills, expertise, and knowledge. So it's in some ways it's built on also data literacy and capacity as well. We need to have those capabilities to focus on how we answer this question and do it in a conscious way. And I would say that we're still in the journey there to building that capacity. It's very hard to come by good data people, good privacy people, and so on. And the problems that we have to solve in this space are actually extremely complex and interdisciplinary as well. So I think that for us to really start in this journey, we need to focus on building some of those capabilities on top of everything that we've already discussed.
Absolutely. Thank you for highlighting that. I think that's a new or not a novel perspective. And now, okay, so like you said, like a CIO for a hospital, we're used to that. But now that we're taking it to a higher level, we have to look at it at that level and be like, okay, let's pull and tap into those individuals and be able to aggregate that together. So thank you for that, Christine. Next, we have Mahmoud. Your thoughts, please.
If I may, I would like to add a kind of a different point, which I don't want to forget. Modernization of PHIPA would not be enough. I would like to add that there are so many other acts that needs to be modernized, and if we forget about those, we're going to lose the importance of the social determinants of health. Social determinants of health are in the data that are governed by completely different acts, not PHIPA. So we have FHIPA, we have vital statistic acts, we have so many other acts that if all of these acts are not being modernized together, we are not going to really address the issues that we're talking. So I wanted to, highlight that we shouldn't forget about that. So it has to go kind of together. And just to be on the fair side, a few years ago, FHIPA went under a modernization for a very good, intention. Although what happened. It was not consulted the lawmakers with a very, very well intention to modernize the FHIPA to allow non-health data to be linked and used with health data for social determinants of health or other purposes. They kind of missed to consult with technical people. Now we are implementing that FHIPA Act. Modernized FHIPA Act, it's very, very challenging to bring it to reality. So in modernization, lawmakers need not to forget to talk to the technical people.
Perfect. No, thank you for that, Mahmoud. I think that kind of tapped into what Christine said, that we now need to tap into those individuals. And I think something else you said in terms of the legislation, just the way right now the data is very individualistic. focusing on one individual legislation will not solve our problem. We have to look at them collectively. And just as you're talking about that, I do want to tap back into Christina, and I'll jump to Don. But when we were talking about public will, and in this round, you mentioned public will again. And so in terms of interests where, as the public, our interests or our incentives are more diffuse as opposed to more of the concentrated parties when it comes to the political side. And they're able to have, for a lack of a better word, more power. So because you mentioned that this round, I do want to tap into you on your thoughts on that with those diffuse interests as a public and the political side being stronger and being more concentrated. Any thoughts on that to still push with the public will?
So data to me is a very fundamental discussion because data about you is you. I say this a lot. It is a representation of yourself, and we know what can happen when someone has access to your data. They can basically recreate you and influence your buying habits, your mood, and so on. So I think that this is a conversation that needs to be had at many, many levels. And yes, we elect our political representatives, and they can make certain decisions. But I think that's why it's also important at the sort of system and grassroots level to also have those vehicles and forums for conversation and discussion. So for people to speak up and for people to publish papers, to have forums like this for discussion about these topics, because the more that we can have this active conversation and put it in the public domain and the public sphere, I think the more that it will catch the attention of our political leaders as well. And maybe just a little bit of on another note in terms of how we make change happen, how we actually put this into the spotlight. Sometimes I think a good Hollywood movie or maybe a Taylor Swift song might actually change the discussion.
Awesome, thank you, love that. Alrighty, last but not least, Don, your thoughts?
I'm not sure how to follow up on that, except to say that any reform of the legislation should not be an early stage. It should be in the concluding stage of a multiple-step process where before that we have some sort of master plan of where data, what kind of data will be collected, how they will flow, to whom they may flow, under what circumstances, all the protections in place. That being said, we usually stop there. We recognize that you're not going to be able to figure all that out in advance. So we need to create what has become commonly called now regulatory sandboxes, which would allow for innovations as they come along to be introduced and under controlled circumstances, under supervision, for example, the Information and Privacy Commissioner or whoever that may be. But essentially that we would need to have a good plan in place to guide what those elements are going to be of the legislation. And as well, in all this, as Christine has pointed out many times, we need the public trust. And a very important component of that is transparency about those data flows. So we may have worked it out, but we're very bad historically at conveying that to the public. Whether there's a sense that there is no interest or they wouldn't understand it, I don't know. But we need to be much more open about that because we've seen multiple misadventures in England in particular when they've tried to introduce reform to their use of data, but they've not adequately communicated to the public. So one is transparency. The other is bringing meaningful involvement of the public in that actual governance process.
Perfect. Thank you for that, Don. So you highlighted once again the importance of bringing the public in, having that transparency. And also you mentioned sandboxes so we can have that area, that pilot to work with that before we take it higher or expand it essentially. So thank you for that. I do want to open up the floor now to the audience. Do we have any questions for our panelists? Yes, I see a gentleman at the back that went first. Please go ahead. Would someone be able to? Perfect. Thank you. So she's coming around with the mic for you. Not yet. Try again?
Okay.
Yeah.
Yeah, I'm Galen, and I'm probably going to ask a lot of annoying questions for this whole conference. I have one thought experiment to sort of put for the panel there. assuming, okay, since AI is our present and our future, if AI can be given all the statistical information and work it out, my question would be for my clients, okay, for the ones that have problems with the law and addiction and mental health, if that could be used for the AI to predict how much help people with mental health need, right? And have the programs available, because right now it's hard to find the programs to help them with their specific issues so that they don't start to self-medicate and get into drugs. And therefore they don't get into drugs, and therefore they don't get into stealing or stuff like that. So they have, because it's a problem that follows, from my experience with these people, a specific path. Mental illness doesn't get dealt with, self-medicated, gets into street drugs. Street drugs leads into crime, and we have people that could be a big resource for society, right? Being locked up and having a hard time getting back. Could the AI predict if we had these programs available, we put this much money into it, okay? Now, my son's a computer genius. He works at the head office at Scotiabank, close by here. And he knows that this stuff is where he can explain it to me, and I get 2% maybe of how he explains it. But he says this is all possible. But do we not still need, right, the political or the community will to take that information and say, yes, these people do have value, and it can be a net benefit and a money savings to get the help they need when they need it. So we need to put the money in these programs to help people before it gets out of control.
Any thoughts from the panelists?
I think you've actually just made your point right there at the end. There's a need for the political will. We can give all sorts of data, but we need to have a receptive audience.
I agree. Yeah, like you made the point, and that's exactly very along with what we were trying to say.
Perfect. Thank you for that. Any other questions? I'm just going to kindly ask the audience to make your questions a bit concise, just so we can get around to more questions if possible. So who do we have next? I did see a couple of hands go up. Okay, the gentleman at the back.
Yeah, my name's Jonathan. I'm a family doctor in Toronto. A very quick question. I tend to think of things at the grassroots level because that's where I work. One of the panelists said that you'd like to see the baton pass for the control of privacy from care providers to the patients. Does anybody there have any idea how mechanistically that could work?
Do you mind just repeating the last piece? I think we couldn't hear that.
Mechanistically, how are patients going to how at the grassroots level are they going to maintain control for their own privacy?
Any thoughts on that?
Maybe I'll take that question. So coming up, creating a system of privacy protection, including patient choice and control over their own information. I think it's not necessarily just a binary kind of a question or decision. Obviously, patients should have some control and choice because it's their data, but we also have a health system and care providers that need access to that data. And right now, for example, if you look at PHIPA, there's actually a balance. There's certainly patient choice and control reflected in consent, but we also have uses of data that are enabled at a system level. For example, research. Data can be shared for research purposes without consent. For example, system planning can also be enabled without having to go back and ask every single patient. And those are legislated permissions because we almost, I think, universally agree that things like research and health system planning are for the greater good, are public goods. So I think we have to have that conversation about what is the balance of different protections and enablements that need to be in place so that we can enable everyone to have access to the data that they want while ensuring safe use of data. So I think that it is a question that has to be answered on many different levels to look at different use cases of data and what are needed and come up with a solution that works for everyone.
All right. Thank you, Christine. All right, next question. We have a gentleman at the back.
Hi, it's Michael Green, Canada Health Infoway. You know, one of the things I wonder, is that working? Yeah, one of the things I wonder is that, I think the time for sandboxes is probably over. And you can't be literate unless you have something to read. I don't think we should use the excuse the public are not literate enough to use digital health. We just need to get it out there. And in fact, there are some programs at the moment on a national basis being orchestrated by the federal government, the PTs, which are aimed at sharing the data. So I don't think we need any more experiments. We need legislation that gives every Canadian the right to look at their own data and share it with who they want to.
Any thoughts to add to that, or we're good? Okay. All right. Last question.
Hi everyone, my name is Jen. I'm actually from Alberta, so thank you for having me. In Alberta, we have an amalgamated health system for reporting as well. We signed on in 2017 to Epic Care, Connect Care, and it's a centralized system used in hospitals, even some physician systems. Now, I'm wondering what the panel's thoughts are on an amalgamated data collection like Epic Care. Like, I'm an addiction counselor by trade. I also work with Inner City Hospital and our virtual opioid dependency program. I could see a patient that's from Southern Alberta virtually, and then I could see them the next week in hospital and update their social determinants of health and their outcomes through that centralized system. That system as well, just like the question back there, allows actually patients to have direct access to their health information and results instantly. Sometimes people are sitting in the ER and they see their blood results before the doctor even comes in to talk to them. I'm just wondering, that level of amalgamation of information and data collection, is that a benefit when we're talking about PHIPA modernization?
Sorry, do you mind just repeating your question, just the last piece? Because I couldn't hear that. Thank you.
Is it good to have access to that level of amalgamation of data collection and also utilization of that data information for modernizing PHIPA? I don't know if my question makes sense.
So let me take a crack at it, and you can let me know. It was a little bit difficult to hear, but I think the first thing I want to say is that patient access to their data is actually not a privacy legislation issue. There are already, I'm sure, across the country in provinces, there's already patient rights of access to data. So that's not the issue. It's an interoperability issue. It's an issue of care providers also setting up the mechanisms to enable that access. So I just want to be clear that some things are already addressed in the legislation. In terms of the level of detail of information that is captured, is that part of what you were asking about as well? And what is needed? Well, I think from a care perspective, our care providers will take capture the information at the level of detail that is needed. As for what level of detail is needed subsequently, that's part of what we need to ascertain is what would a system planner need? Do they need access to all of it? It's sort of data minimization principles would then kick in at that point to make sure that people only get access to the data that they need for the purpose that they need it for. So I think that's something that we also have to have explicit conversations on to make sure that there's a clear understanding by everyone involved and clear standards for how that's done.
Thank you, Christine. And I think, Don, you wanted to add something to that?
Partly to this, partly to the previous comment that was made. Privacy has traditionally been regarded as being tightly connected to consent and control over who has access to your information. It's often been on a transactional basis. It's traditionally been on a transactional basis. Increasingly, that is difficult to do given the way that we're talking about we're going to be using the information. And probably what we need to be doing is moving toward consent for flows of information, types of uses of information, as opposed to expecting it would put too much of a burden on an individual to get their approval for each and every use of their information. But for them to know that there is going to be a research use of it, maybe they might want restrictions on that because people worry if there's going to be a stigmatization potentially. But we need to probably back off from the control in this current environment, the individual transactional control.
Thank you, Don. Do we have time? Okay, so last question, please take it away.
Great. Hi, David Kaplan, family physician, and associate professor here at U of T at the Joint Center for Bioethics and the Faculty of Medicine, and vice president of Ontario Health in quality. So lots of different hats, but all converge here in this question, I think. Before we modernize PHIPA, do you think we need to get a better understanding or a shared understanding of what the current legislation actually allows for? So I'll give you an example to everyone. Right now, you could ask 2, 3, 4 different lawyers whether or not if a patient received care at my hospital, cancer surgery at North York General Hospital, and then presented 12 days later and died at Sunnybrook Hospital, whether or not we as a system could share with the clinicians at North York General Hospital the outcomes of that patient. And I think you'd find lawyers that say you could, and I think you'd find lawyers, and I see Christine shaking her head, nodding her head, I should say, saying lawyers that would say you couldn't. And I wonder about whether or not the first question is a shared understanding of what PHIPA says right now, and a shared understanding of what the public wants PHIPA to say right now before we actually think about modernizing it.
Christine, all right, go ahead.
So I would absolutely agree that we need to have a shared understanding of what we want to have happen. That is amongst clinicians, that is amongst patients as well. That is the fundamental question. What do we want to have happen? What do we mean by the public good? What do we mean by the greater good to be served? So I think that's actually the first question that we need answered. With regards to the question of, does PHIPA allow it or not? I think it goes back to the fact that PHIPA is subject to so much interpretation. And those interpretations are idiosyncratic, basically. Every doctor decides differently, every hospital decides differently. Even within the legal community, there are differing interpretations. And I think that the complexity of PHIPA that engenders that kind of situation to happen, we have to actually fix that to allow ourselves to have a much more common approach to understanding how the legislation works and how it is administered. Is it all a legislative problem? Not necessarily. There are probably things about the legislation that we can be more clear and more prescriptive about, absolutely. But I think it also goes to the fact that we need to have clearer governance around how our data sharing infrastructure and processes work. We need to set some standards, some common understandings of how the rules should be administered, how the rules should be interpreted, and so on. And we currently don't have that because the control happens at a very local level. So we don't really have any structures at a provincial level. And I'm not saying it has to be the government, but there's no body or entity to administer to this at a system level. And that's where it breaks down.
Awesome. Thank you, Christine. So that brings us to the end. Just going to wrap up. So our conversation, our panel discussion today about whether PHIPA is good enough or time to modernize. The consensus was it's time to modernize, but there were so many other moving pieces, right? We identified legislation, consent, public will, political will. There is so much. But I do want to give one last opportunity for our panelists to share one last tidbit. So my headline question, so we're going to fire through each of you, is let's say you had a magic wand and you could fix any one problem that would allow us to access data for all we want to do, AI, digital health. What would that one thing be that you'd wave your wand on? Starting with Mahmoud, please take it away. What's your one thing?
Well, perhaps I would come from my background, which is the record linkage. I think what is missing in Ontario is a provincial record linkage center. There are a lot of duplication of efforts, a lot of different ways and techniques for linking data, which is the very first thing you need to do in order to use the data. And I think that would be my wish.
Awesome. All right. Record linkage. Next, we have Christine. Please, what would your wish be?
Think about data as a public good, not an asset, and think through what that would mean in terms of how we do things differently.
Perfect. And last but not least, Don, what would your wish be?
I would trade my magic wand for the finances required, the expertise required, and the political will to create that infrastructure, that secure and trustworthy infrastructure that would allow for those data flows to happen. And all for the purpose, as Christine pointed, of the public good.
Awesome. Thank you so much, panelists. So that brings us to the end. So the purpose of this whole FHLIP Conference is to be a public sphere. So conversations like we had today, how Christine also alluded to, this is just the starting point, right? But the purpose is to have these conversations, to have that awareness. But what happens is we have these conversations and then we stop. So we take one step forward and then 5 steps back. So with the public sphere, we have to continuously have that open dialogue. So the day has just started. This is the first panel discussion you've had. There's so much more. Please take advantage of that. Participate in those conversations. Because this is just one puzzle, and we've noted that there are so many puzzle pieces to come together to solve it. So please make sure you take advantage of that. We do have a little thank you to show our appreciation to our panelists. So please give a round of applause for our panelists as I do present it to them.